If your kidneys are in danger, your body may send you important signals. Today, we will discuss 12 crucial signs of kidney disease. For those who have suffered from, are currently experiencing, or know someone dealing with liver disease, it's vital to recognize that kidney issues can also be silent killers. The danger lies in their often late diagnosis. Many people are unaware that the symptoms of kidney disease can be subtle yet significant. Unfortunately, some signs may not appear until the condition reaches a critical stage, making early detection essential. Before we dive into the signs, don't forget to subscribe to our channel and turn on notifications so you never miss our new videos. Let's explore the top 12 signs of kidney disease that you need to be aware of. 1. Changes in urinary function. One of the first signs of kidney disease is a change in urinary patterns. You might experience an increase or decrease in how often you urinate. For instance, if you find yourself making more frequent trips to the bathroom during the night, this could indicate a problem. Conversely, if you notice you're urinating less frequently or in smaller amounts, it's important to pay attention. Changes in urine color can also be a sign. Darker urine may indicate concentrated waste due to dehydration or kidney issues. Additionally, you might feel a strong urge to urinate but struggle to do so, indicating a potential obstruction. Keeping a diary of your urinary habits can help track these changes. 2. Difficulty or pain while urinating. Experiencing discomfort, pressure, or pain while trying to empty your bladder can signal a urinary tract infection, or UTI. UTIs are common and treatable, but if they are left unchecked, they can spread to the kidneys, leading to more serious complications. Symptoms may include a burning sensation during urination and an increased urgency to urinate with little output. If you notice these symptoms, it's crucial to seek medical attention promptly to prevent further complications. 3. Blood in your urine. The presence of blood in your urine, known as hematuria, is a symptom that should never be ignored. This is a direct cause for concern and may indicate kidney disease or other serious conditions such as bladder cancer. Blood can appear pink, red, or even brown, and if you notice this symptom, you should visit your healthcare provider immediately. Hematuria can sometimes be accompanied by other symptoms, such as pain or swelling, making it even more critical to seek medical evaluation. 4. Foamy urine. Foamy urine can indicate that protein is present in the urine, a condition known as proteinuria. While it might seem like a minor symptom, foamy urine can signal that your kidneys are not filtering waste effectively. This symptom is particularly important because it may suggest that the kidneys are allowing protein, which should remain in the bloodstream, to escape into the urine. If you consistently notice foamy urine, it's essential to consult with a healthcare professional for further testing and evaluation. 5. Swelling or edema. When your kidneys can no longer effectively remove excess waste and fluids from your body, you may experience swelling, known as edema. This can manifest as puffiness in your feet, ankles, or even your face. The accumulation of fluid can also cause tightness in your hands. Edema can be uncomfortable and may restrict movement, making it essential to monitor this symptom closely. If you notice significant or unexplained swelling, consult your doctor to investigate the underlying cause. 6. Extreme fatigue. Healthy kidneys produce a hormone called erythropoietin, which stimulates the production of red blood cells. When kidney function declines, levels of this hormone drop, leading to a decrease in red blood cells and oxygen delivery throughout the body. This sudden drop can leave you feeling extremely fatigued and weak. You may find that everyday tasks become tiring, and your overall energy levels significantly decrease. If you experience persistent fatigue without an obvious cause, it's worth discussing with your healthcare provider. 7. Dizziness and inability to concentrate. The lack of oxygen due to reduced red blood cell production can also affect your brain function. This may lead to symptoms such as dizziness, confusion, and difficulty concentrating. If you find yourself feeling lightheaded or having trouble focusing on tasks that usually come easily to you, it could be a sign that your kidneys are not functioning optimally. This brain fog can significantly impact your daily life, so it's important to address it with a healthcare professional. 8. Feeling constantly cold. Kidney disease can lead to anemia, which can make you feel cold even in warm environments. You might notice that your hands and feet feel unusually chilly and that you need extra layers of clothing to stay warm. Additionally, if you experience chills or fever, it could indicate an underlying infection, such as a kidney infection. Feeling cold consistently is a symptom worth discussing with your doctor, especially if it is accompanied by other concerning signs. 9. Skin rashes and itching. Skin rashes may often be mistaken for allergies or other skin conditions, but they can also be symptoms of kidney disease. When kidneys fail, waste products build up in the blood, leading to severe itching and skin irritation. This itching can become chronic and may not respond to typical treatments for skin conditions. If you develop unexplained rashes or persistent itching that doesn't seem to improve, it's essential to discuss these symptoms with your healthcare provider for proper evaluation. 10. Ammonia breath and metallic taste. Kidney failure can increase the levels of urea in your blood, leading to a condition known as uremia. This can cause your breath to have a strong ammonia smell, often described as fishy or metallic. The urea is broken down into ammonia in the saliva, resulting in this unpleasant odor. If you notice a sudden change in your breath or a metallic taste in your mouth, it could indicate that your kidneys are not functioning properly, warranting further investigation. 11. Nausea and vomiting. If your kidneys are failing, you may experience persistent nausea and vomiting. This is not just a one-time occurrence. It can become a frequent problem as waste products build up in your body. This ongoing nausea can significantly affect your appetite, making it challenging to eat and maintain your nutrition. If you find that you're experiencing regular bouts of nausea and vomiting, it's important to discuss these symptoms with your healthcare provider. 12. Shortness of breath. In advanced kidney disease, fluid can accumulate in the lungs, leading to feelings of breathlessness. This may create a sensation similar to being out of breath after physical exertion. Additionally, anemia caused by kidney dysfunction can further deprive your body of oxygen, contributing to feelings of fatigue and shortness of breath. If you find yourself experiencing unexplained breathlessness, especially with minimal exertion, it's crucial to seek medical advice. While many of these symptoms may also be associated with other diseases and infections, they are worth discussing with your doctor. Early detection can save your kidneys and potentially your life. Don't ignore the signals your body is sending. If you found this video informative, please hit the like button and subscribe to our channel for more valuable health content. Thank you for watching, and take care of your health.